Here we are. We have a patient here lying on the table. She's lying prone, face down. She is one who suffers sciatic type pain. And what we're doing here is that we're looking at the pelvic. As we look at the pelvic, we can see that the pelvic is shifted, and we know that by looking down at the lower part of the legs, particularly in the feet, we can see imbalance. Here we can see approximately a 3/4 inch deficit on the right as compared to the left. Dr. Shapkin, the chiropractor here who will be taking care of this patient, is going to adjust and correct the pelvic area in the lower back, which we will explain to you more thoroughly in just a minute.
Hi, I'm Dr. Shapkin. I'm going to be adjusting this patient. Diversified technique. It's a high velocity, low amplitude thrust designed to help shift the pelvis and take the pressure off this area. We're going to be making some corrections or changes designed to help stabilize and allow this to reach a balance or homeostasis. What's going on with the patient right now, the ilium on the right side of the pelvis has shifted posterior and inferior. I'm going to place the patient in side posture right now. Go ahead and please lay on your side facing towards me. Thank you. I'm going to bend the leg in this position here to take the pressure off the hamstring and the quadricep. I'm going to make a contact. I'm going to be using my pisiform contact, which is my manual contact, on the posterior superior iliac spine of the pelvis. And we're going to make a correction with a line of drive thrust posterior to anterior. Go ahead and lay face down. Thank you.
We're actually analyzing the leg length. As we take the rotation out of the pelvic, we can see that the leg length is actually balanced out, where the right leg, which was shorter, has now equaled out. In order to have a better understanding of sciatica and lower back, I wanted to say a few things about the spine. These are the lumbar vertebrae right here, and you have nerves that come off between the vertebrae, and what we're concerned about is that the two lower nerves that come out, the L4 nerve and the L5 nerve, as well as the first three sacral nerves, make up the sciatic nerve. The sciatic nerve is the size of my thumb. That's the largest nerve of the body. That's the nerve that comes off the lower back, comes underneath the pelvic and stems down the back of the thigh, all the way down the back of the thigh, all the way to the knee and the outside of the thigh. It does not go in the front of the thigh. The thighs, the nerves that supply the front of the thigh come a little higher up in the lumbar spine. But once it gets to the knee area, it can branch out through the rest of the leg into the foot, into the big toe, commonly with burning, tingling, numbness, cramping, aching, tiredness.
Made with the patient earlier is there was a pelvic problem. We made a correction in the right ilium. Let me do a little bit of anatomy lesson for you. The pelvic is made up of a triangular shaped bone called the sacrum. The two curved shaped bones here are called the ilium bones. We have the two ball and socket hip joints. These are the femoral heads as they sit inside the acetabulum. In the patient we saw earlier, the pelvic had shifted posterior and inferior on the right side, which caused a rocking here, and we noticed a leg length discrepancy on the right side of approximately 3/4 of an inch. When we made the correction, we contacted this area called the posterior superior iliac spine. We adjusted it in a posterior to anterior line of drive and made a correction, taking the pressure off. Immediately afterwards, you could see that there was the leg length had come back to balance.
We have ligaments that actually hold these bones together, and people ask, how do these joints get out of position? Well, there's a lot of gravitational forces and stresses that take place day to day with the way we sit, the way we bend, incorrect posture, and a lot of these different forces will actually weaken these ligaments, causing these joints to misalign, what we call subluxate. Subluxate means to come out of its normal position. When that happens, it can actually affect nerves, causing nerve irritation. Kind of like you're stepping on a garden hose, watering a garden. If that nerve pressure is not taken off, you're going to have less energy supplying to wherever that tissue is being affected from the nerve. So actually what Dr. Shapkin did here is that as we realize, we look at the pelvic, these two joints work independently. The left ilium and the right ilium. Here's the sacrum. This is the sacroiliac joint, the most commonly affected joint that causes sciatica. many people will complain that they have lower back pain. They'll notice that through MRIs, you can see a disc herniation here, which may affect the nerve. But from the findings over all the years that I've been around, which is 25 years plus, most conditions stem from biomechanical problems. Even though herniated discs may be seen, these discs can be dormant, lying there for several years, and never even knew that these people had these particular disc pathologies. But all in all, what Dr. Shapkin is saying, what he's done pertaining to the adjustment, is that if you look at the back of the pelvic here, and if you look how the pelvic rotates back, the leg length comes up. And if you look at the pelvic how it comes up, the leg length will come down. So we are using these as levers to help balance out leg length inequality.
The balance we saw in the patient is common. It's after the adjustment, it's oftentimes seen that the patient can't believe they actually get up and feel a change. A lot of the problems we've noticed, especially in men, they keep wallets in their back pocket. It's a habitual thing. They've probably been doing it since the age of 12. Keeping in the back pocket when they sit down, it causes the pelvis to shift, and this inevitably causes an imbalance, which creates the symptoms that we were talking about earlier.
I'm going to explain the anatomical and neurological chart on how the nerves correlate and what they control in the spine. If you look at the central nervous system, which is the brain and spinal cord, that controls every system of the body. It controls the heart, lungs, liver, gallbladder, spleen, small intestine, large intestine, male, female reproductive organs. It supplies everything. But what we need to understand is that the nerves that supply the organs, we don't necessarily feel when there's nerve compression or irritation. The nerves that generally affect the lower back, you're going to feel pain. The nerves that affect the mid-back, you might feel pain between the shoulder blades. The nerves that affect the neck, you may feel pain going down the arm or into the shoulders or into the fingers or tingling or numbness. But for our purpose here that we're looking at sciatica and lower back pain, we can see that the lower nerves here do correlate to the lower back. You can see that when their nerves are being affected and they're being impinged and irritated, this nerve, the sciatic nerve, the longest, largest nerve of the body, makes its way out of the two lower lumbar nerves called the L4, L5, and the first three sacral nerves, forming the largest nerve of the body, and travels all the way down into the foot, into the big toe. Tingling, numbness, cramping, burning, pain. But also it's important to realize and understand that the nerves control the intestines, male, female reproductive organs, the urinary tract system. People who have lower back conditions may have urinary symptoms, intestinal symptoms like constipation, or other conditions related to those organs where that nerve is also supplying. I'd like to show you an anatomical model of two vertebrae, a disc, and a pair of nerves that come off in the lower back area. If this is the vertebral component in the lower back of the L4 and L5 nerve, we can see that the nerve energy that's coming out from the brain, that's making its way down the spine, has no pressure, has no complication on that nerve, no interference. If we have any shifting or misalignment, we can see the interference because the messages from the brain is sending it down the spinal column, down the spinal cord, through the spinal column, that's making its way out that nerve to wherever it's supplying is being affected. The purpose and the most important thing of these conditions is removing the cause by getting the pressure back off the nerve. By taking medicine or anti-inflammatories or muscle relaxers is not going to correct the causation of this etiology. I'd like to show you the anatomical changes that take place in the spine, particularly while we're sitting. Bodies of the vertebrae are in front. These spinous processes and facets are in the back. When I lean back like this is what happens. And as I lean forward, you can see the curve becomes straighter. But normally when we sit and we stand, we're supposed to maintain this normal lordotic curve. So while sitting, I do recommend putting a lumbar support pillow or a small pillow behind the lower back to help stabilize the lumbar spine as well as the pelvis. Without a support in the lower back, the weight bearing is being transmitted with most stress into the vertebrae, the discs as well as the nerves, with the support being stabilized behind the lower back area. with support being stabilized behind the lower back area, we then fulfill that gap that's being taken away from the lumbar spine, which allows it to be equally transmitted into the pelvic area symmetrically. As you can see, when he sits up, there is nothing being supported into the lower lumbar spine. The lordosis has no support. Therefore, when he's sitting up, what will happen is his shoulders will start to slouch, his head will eventually go forward. So people who have lower back weaknesses will eventually start to experience compensatory changes upwards into the shoulder and head region, into what we call a forward head translation. When we take the support and we support the lower back area, as he brings his pelvic back, his shoulders become more aligned. He fulfills the lumbar lordosis with the support, allowing the equal amount of weight from his upper torso to be equally distributed into the pelvic area, which will relieve a lot of lumbar neuritis, inflammation, and sciatic type pain, which is pain going down the leg into the ankles or toes. So any type of pain, tingling, numbness that stems from the lower back, those nerves supply the lower back area, the buttocks, as well as down the lower extremities. Okay. Important lower back exercises and stretches for lower back and sciatic type patients. First one is a single knee chest of the patient. Hold the knee, pull up, and you're going to hold that stretch for a good 10-15 seconds, and that will actually stretch the lower back on that side. We'll release it. We'll go ahead and pull the other side. Pull up. As you're pulling and exerting, you could be exhaling. Good. Hold it for 10-15 seconds, and we can do actually 3 sets of each leg. Very good piriformis stretch lying down. You're going to bring one knee up, put this ankle behind the knee. They'll grab the leg and they'll pull back. And as they pull back, they'll be stretching the piriformis muscle, which is the main muscle where the sciatic nerve runs underneath that muscle going down the leg. They'll hold that the same, 10-15 seconds, and they'll alternate. You'll do the other one. Good. Grab underneath the thigh and pull back. Okay? And you're going to hold 10-15 seconds, 3 sets of that. Relax. Drop the knees. The last stretch, very important, are the hamstrings. Take one leg out, either on a bed, a couch, or on the floor. I want you to lean forward, the chest to the knee, and just hold it. Never bob. Just hold it, because you don't want to hurt and overstretch the muscle too fast. 15 seconds. Then you're going to go ahead, scoot over, and you're going to do the other one. There you go. All the way forward, and you're going to hold it. And we're stretching the muscles behind the thigh. Good. And the reason why we stretch those muscles, because the muscles behind the thigh, here is the back of him, how he's sitting. Here's the normal lordotic curve. Okay? Here's the back of the thigh over here. But these muscles all behind the thigh attached underneath the ischial tuberosity, right in here. And as those muscles pull, the pelvic can be rocked backwards. That's why when you lean forward, you get a lot of locking effect. That's why you have a lot of decreased range of motion because of tight hamstrings. So by stretching the hamstrings, you'll see amazing results when it comes to lower back pain.